Dr. Calabrese, let's talk about the pipeline again. We were going back to the old what's coming up next question. What are your expectations for these newer therapeutic agents in the development right now for the management of cardiovascular health in patients with comorbid cardiometabolic disorders?
I just say I'm cautiously optimistic. Again, I think the truth is, is in the pudding, in that we need to see more data with these agents to truly determine their role. I think that as with agents that have been recently introduced and ones that are in the near-term pipeline, the preliminary evidence suggests that there is value there. How that value translate into real-world outcomes. Again, I'm optimistic, but it will be determined based on increasing evidence.
Now, I promised you at the beginning of this discussion we would get to this point, and here comes the 2,000-pound gorilla. I don't know how heavy gorillas are, 500-pound gorilla.
The 2,000-page gorilla.
There you go. Well, that too, which is the Affordable Care Act, or the Patient Protection and Affordable Care Act, an ongoing health care reform. What's going to be, and we don't have to have a 2-hour discourse on this, but what's going to be the effect on morbidity, mortality, clinical expectations, and what are the barriers to successfully phasing all of this in? Anybody want to just take a whack at this?
I think this is our last shot to get it right. We spend a ton of money, as Ken talked about, on healthcare in this country. We have one of the lowest in terms of other advanced economies. We have one of the lowest quality performance of any of these countries, despite the spending. We have to get it right. I think as a nation, particularly those of us practicing in the healthcare environment, we have to embrace what healthcare reform is set out to do, and that is, to decrease the fragmentation, to increase the coordination, to take better advantage of information technology to be able to create these communication links and connectivity that are necessary, to focus more on the prevention and the wellness. All of which I think, if done right, will help us to achieve what healthcare reform is set out to achieve, which is improved outcomes, improved quality of care, and improved economics.
Yeah, the hook is if done right. Dr. Schaecher, what's your expectation here?
Well, I think the Affordable Care Act is the first act in a longer play. I think the goals of the Affordable Care Act were noble. I think, unfortunately, it didn't achieve everything we had hoped it would achieve. And should a certain party in Congress ever decide to move on, maybe we'll move on with further efforts. But the Affordable Care Act itself, I think, will have an impact. Things that have been implemented. As I said, it was designed to provide a means to ensure at least a portion of the 46 to 50 million people who are uninsured. Those individuals getting insurance will provide them access to care so they're managing their diseases at an earlier stage. That alone should impact morbidity and mortality. There may be a bump up for a period of time as people who didn't realize they were going to have disease, that they had a disease, find out they have it, but over time I think it will accomplish that. Other aspects of that legislation, which included the preventative benefits, which were designed to remove one of the barriers to health care delivery, which is cost, by saying these things will be free. Now, there are tons of exceptions to those rules. It doesn't apply if you're a self-funded group. It doesn't apply if you're Medicaid. And so there are issues around that. I think it should also impact accessibility to care for patients from one perspective, in that they will have access to care because they can now pay for it. The flip side of that is there may not be enough providers to provide that access, and that causes us to start to rethink the delivery of care. So one of the things that the ACA may also do is give us pause to say, maybe we need to do this differently and change our model of care from acute care to chronic care. And there are other things, the HITECH Act and other things that are impacting that. So I think overall the positives outweigh the negatives. I think it will have an impact, but there's a lot to still be done.
And all the healthcare professionals, it seems to me, are going to be more interconnected going forward than they ever were.
Well, it sounds so nice, but I don't know if it's what
So
you're
now
going
you're
to
raining on his
see.
parade.
Well, I'll tell you, I think that I like the goals. Obviously, any physician likes these kind of goals, access to care. Everybody, will get, free stuff and not free stuff and what have you. But I think the word affordable is not correct. It's not affordable care. I look at things globally, and if you tell me that globally you're going to reduce the cost of a system by $10 trillion, and you will increase the system by another 40, 50 million people, and it will improve the way you give care, I don't think it's possible. So I think that there are a lot of things and the way it's designed probably cannot work. The practicality is what happened to a good friend of mine, works in a small group of 12 physicians. They were all primary care. He was the endocrinologist. They have to see a certain amount of patients a day. He needs to take care of his diabetic patients. He makes 50% of what they do. He stops actually doing any more special care. Is only going to look at the patients. You throw in another 30, 40 million patients into the system. What you're saying is what I saw going to a place called Glendale, not too far from here, next to Los Angeles. I walked to an office, and now the docs are saying there, every patient for 6 minutes. That's what it is, twice a year. That's what the patients get. How do you deal with it? We only deal with one aspect. All you did today is one issue. And I think that there is a lot to come that will make great objectives and idealism and make it true practical. So let's hope it's a first step and a lot of refinement comes forward.
And I don't want to leave this without